Hello, I'm Eric Friedlander, Secretary of the Cabinet for Health and Family Services. The first thing I want to say is thank you. You all have made a difference in the impact of COVID-19 in Kentucky. You've worn masks, you've washed your hands, you've observed social distancing, and you can tell that we, as the governor likes to say, cut the top of the muffin off of that curve. And it's going to be a continuing challenge because we are not done yet. We're starting to reopen our economy, which is very important. But in order to keep it open, in order to continue to be able to function as normally as possible in this time, there's a very important piece that we have to ask. And that is the contact tracing is going to begin now. So we've got the widespread testing, but when we start to see the spread of the virus in specific areas, in specific workplaces, we're going to need to be able to track that down and make sure that people self-isolate as quickly as possible. So you may receive a call saying you've been identified or had a contact with somebody. This is important to answer that call and respond appropriately. This protects you, it protects your fellow citizens, and it protects every Kentuckian. Nobody's going to ask you for your personal information. Nobody, if they do, then you need to contact the Attorney General's office. It is completely private. There is nothing dangerous about this. There's no conspiracy theory. I want you to know that. If you're hearing some different things out there, it's just not accurate. We are trying to protect you and your fellow Kentuckians, and that is all. It's something that we have done in local health departments. If you've got friends who work for local health departments, ask them. This is something we have done for years. We trace diseases to try to minimize the impact on our communities, on our families, on our towns, on our counties, on our schools. We've done this over time. We've done this for STDs. We have done this for meningitis. We all know that we've heard these things before, and one of the important parts that local health does is this contact tracing. This is on a scale we've never tried before, and it will not work. It will not work unless you are able to help us, unless you answer the call and work with us to protect everyone in Kentucky. We've done it. We've done a lot of it. We've got a lot more to do. I know we can do this. I know that in our hearts what we want to do is make sure that we are all safe, and this is the way that we can do it. So, thank you. Thank you in advance. This is something I know we can do and do together. Thanks.